Hello, parents and educators and caring adults. I am so glad that you're here with us. Today, I have with me Andrea Jones to talk about parent health, like parent physical health, when we have constant caregiving stress, because it can have a huge impact on our physical health. And I think it's something that needs to be on parent radar, but also we need strategies. How do we maybe circumvent some of this? How do we prevent some of it from happening? So, Andrea, will you start by introducing yourself to the audience and then we'll jump into our topic?
Absolutely. Well, I'm Andrea Jones. I am a registered nurse, functional health practitioner, and parent of a child with special needs. I actually spent the first 15 years of my career working in inpatient pediatrics. And so I got to see firsthand how childhood illness really impacts families, both acute illness and chronic illness. It wasn't really until I had my own experience with that as being on the parent side of things that I really started to understand, like, okay, like we're no longer in an acute stress situation. Like, this is now a marathon. This is not a sprint. And I have to start to think about this differently. So I think my clinical experience, my professional experience did inform me because I was listening to parents a lot, of what they were going through. As nurses, we're not just supporting the child, we're supporting the whole family in that setting. But it's like reading a book about a subject and then living the subject, right?
Yeah.
Those are two
Yep.
different learning experiences. But I really do feel like that experience helped kind of shape how I started to think about taking care of myself. Because for many years, especially, when my daughter was first diagnosed with PANDAS, I would say the first 3 years after that, it was extremely high stress. And, when you're in that situation, it feels like nothing I do is going to make a difference because it doesn't change the stressors, right?
Right.
And so I found myself getting stuck in that thought loop a lot of like, does it matter? Like, it's not really making an impact. Um, until I realized I had no choice but to do something different. So that's a little bit about my background, what we're talking about today.
Yeah. And I'm so glad that you said we can't change the stressor, but we can change our response to the stressor. We can change what we do for ourselves under that stress, right?
Absolutely.
And so let's start by sort of defining what we mean by chronic caregiving stress. What does that look and feel like?
Yeah, it looks and feels distinctly different, and the research does differentiate that from like an acute stressor. An acute stressor is a very short-lived, maybe it's a few days to a few weeks of an illness or a behavioral issue or a kid goes in for surgery for a broken leg and they have to learn how to walk with a cast again. That's an acute stressor, but doesn't have a lifelong impact in most cases. A chronic stressor is long term, tends to be life changing, meaning like I can look back at her diagnosis and say, absolutely, beyond a shadow of a doubt, everything in our life changed from that point. How we functioned as a family, how that changed my ability to work. Like there were multiple layers of stressors, right?
Sure.
And I think that's the other important piece to this. With chronic stress, it's never just one stressor. It's multiple layers of stressors, which I'm sure you've talked about too.
Hmm.
But a chronic stressor is long term. And therefore we have to think about strategies differently because any of us can endure a short-term stressor because we know in the back of our head, 3 weeks from now, the doctor said we get the cast off and life gets to go back to normal, right? But many of us that maybe are parenting differently wired children or children with a chronic illness or a behavioral or whatever diagnosis, we don't have that. Excuse me, we don't have an end date, right, to when
Yeah.
that stress might be. And I think that's without diving into what the research defines as chronic versus acute, that's how I would describe it. There is maybe no end in sight. And that changes how we think about our stress too.
Hmm. And when you say multiple layers, like I'm thinking about our own stress of the parenting that we want, the childhood that we want to create for our kids, then the stress of the way society says we should parent, then the stress of the school saying, well, your kid has to get here, they have to behave in this certain manner, they have to perform, to this certain level, right? And that's just three aspects. There's so many more. So it can be really
Right.
this like just layer upon layer upon layer of stressors coming at us.
Right.
How do we then, reduce the impact? I don't know how else to say it.
Right.
How do we keep it from affecting our physical health? And what does that even look like? I don't know if you want to start with prevention or if you want to start with what it looks like if we don't go down the path of
Yeah.
prevention. I'll leave that up to you, but
I
that's where my brain is going.
Yeah, and I think so many of us, I thought I was doing fine until I wasn't, right? And because I have
Yeah.
a pretty strong internal I have a lot of internal strength, I would say, to me. And so there were a lot of signs that I ignored in myself, and I think that's very, very common. I know at least, the parents that I talk to, it's very common. We ignore those little blinking lights on our dashboard that are saying like,
Hmm.
hey, I'm not really doing well, right? And so for me, and we'll talk about what those are, but for me, I thought I was doing well till I wasn't. And then it was like every little thing felt like too much, right? And then I
Hmm.
realized like, oh, I have gone beyond like what a normal, like well beyond what a normal capacity should be. And now I really have to start looking at why am I not resourcing myself? Because it wasn't necessarily a matter of I can't resource myself, but I had some pretty strong part of that internal strength in me is a little bit fiercely independent, not wanting to ask for help, because maybe you've experienced shame in that area, right? Like maybe you have in laws that don't understand you or they don't understand what's happening with your kids. So they're not going to step in and help. Maybe you are tapped out of financial resources, right? And so that prevents you from, or it feels like a very legitimate obstacle, right? So for
Sure.
me, I very much learned the hard way of like massive burnout that showed up as, lots of physical health issues. My gut was a mess. My hormones went wackadoodle crazy, which could have been a little bit of perimenopause, could have been probably the combination of both. And I just fell apart. Like my whole body was just like, yeah, girl, we're done. Like you can't
Yeah.
keep going at this rate. So now I'm a lot more strategic with myself, and I'm a lot more strategic with parents in helping them to identify what's the one thing you can do today that it may not feel like enough. Like we're not trying to eat the whole elephant in a day, right? It's the metaphor is how do you eat an elephant one bite at a time? Terrible
Yeah.
metaphor, I know, but like it gets the picture across, right?
It does. Yeah.
And so, what's the one thing that I can do today? And for me, that meant really kind of getting over myself, for lack of a better word, and learning to ask for help and learning to advocate for myself in a different way. And doing some of the things that I felt like privileges almost, like moving finances around to go to therapy, right? Or making sure that I was going for walks every day or 3 times a week so that I got breaks from my child, right? Those felt like luxuries, and I had to learn that they actually were not luxuries, like, they were lifelines, and so, um, yeah, so I learned the hard way, and now I'm a lot more strategic about preventing because I've experienced the extreme end of that burnout state, right? Of
Hmm.
having difficulty getting out of bed in the morning and having no energy for anything, and a lot of health issues that came from that.
Yeah. Yeah. I was struggling for a while with my health, and it took, I think it was 3 years and seven doctors to get a diagnosis of fibromyalgia.
Yeah,
And the way that we finally figured it out was every time there was a stressor, like a big stressor,
yeah,
I was in pain.
yeah,
And but it helped me to recognize how important self care is, and that self care isn't like taking a vacation or getting a
right.
massage. Self care is being able to manage stressors without them tearing us apart, right?
Absolutely. Yes,
And that is a totally different picture than what we're typically talking about when we talk about self-care. And so I think this
exactly.
conversation is so, so important because there are all sorts of different physical things. Do you want to name some of the more common physical ailments, I'll call them for lack of a better word, that can
Yeah,
come from chronic stress?
absolutely. I would say for women, obviously mothers, especially difficulty sleeping. That is a big sign that your stress system, your nervous system is dysregulated, because we digest our day while we're sleeping, not just literally, but emotionally as well. And so we don't recognize that how I spent my day, meaning I didn't eat regular meals, right? Even if it was a snack of protein, right? I didn't get enough water in. That's going to spill into your nighttime, right? And so a lot of times women will
Yeah.
come to me like, what supplement should I take for sleep? And my first question is, what does your day look like? And they get confused because they're like, wait, I asked you like what supplement I should take for sleep. I'm like, well, I got to know some things first, right? So sleep dysregulation is a big one. Waking up at that 3 a.m., heart racing, like feeling
Mhm.
sweaty, kind of panicky feeling. That's not usually just anxiety. Usually that's also a cortisol slash blood sugar dysregulation issue. Fatigue, that's another big one where because you're not sleeping well, you wake up not feeling rested. And then by 2 or 3 in the afternoon, you are completely done for, right? Which is like when your kids are getting home from school and their
Yeah.
second wave of intensity is hitting, right? So,
Hmm. The
so it's
worst
like
time.
the worst time, you've gotta be on, and you can't be because you're exhausted, and that's when we feel guilty because we're snapping or we're irritable, and it's because our body is sending up these cues. Digestive issues is another really, really big one. I see
Mm.
a lot of women with heartburn, reflux, bloating and gas, constipation. Those are really common signs that you may not think are connected, but they absolutely are connected to, if you are in stress, your digestive system, because of how it's connected to the vagus nerve, is going to be the first thing that's impacted. And I know for me, like I ignored a lot of signs of digestive issues until not until it was too late, because it wasn't too late, but it was like it took so much work to come back from that. And that was just, it was like, yeah, that was 7 years of the most intense stress I've ever had in my life. And so,
Mm.
I would say those are the 3 big ones. There are some subtle things that we can see on blood work too that can tell us, that somebody is really living in more of a chronic state of fight or flight. But symptom presentation wise, those are, I would say, the big 3.
Mm. And can it also affect things like our cardiac health or
Yeah.
things like that? Let's talk some about cortisol
Yeah.
because we see the term cortisol all over the place now. And I think it's really important to understand what cortisol is, what role it's playing,
Yeah.
so that we know what to do with this information that we're getting
Yeah.
about or that we're hearing like little snippets.
Right. Yeah, so cortisol it's a hormone produced by your adrenal glands, so it just sits right on top of your kidneys. They're these 2 little walnut-shaped, organs that just sit right on the top of your kidneys, and their job is to, I mean, if you think about cortisol, it's a very energizing hormone. It's what controls when you wake up, how you wake up, what your energy peak and dip is throughout the day. It's also, if you think of the extreme end of that, it's, if you are being chased by a bear, that is what gives you the energy to outrun the bear when you physiologically should not be able to. So many of us, we have, without our own consent, right? We've been thrown into this world of special needs parenting or parenting a child with difficulties. You're in a caregiver role now that you didn't sign up for. And that's what allows us to step into that place and survive the initial stages, right? But then what happens after that, if we don't ever come out of that chronic release of cortisol where the body's like, we're in survival mode, we've got to keep releasing this energy because she needs it to survive. If we don't ever come out of that, then what happens is specifically for women, the pattern I see the most often is not high cortisol, it's low. Like you've bottomed out
Mm,
completely. The symptoms look very similar, which is why blood work and urine testing can be really helpful to help us identify, like, are we in a high pattern or a low pattern? Because that changes how we treat the symptoms. That's actually what this is what I had seen anecdotally in my practice over the last 7 years was like everybody's bottomed out in their cortisol, and yet they think they have high cortisol because the symptoms kind of mirror each other. But that's
right.
what the research shows. The research shows that caregiver stress, the burnout looks different physiologically. It tends to not be high cortisol, it tends to be low, but then what happens is paradoxical, meaning that you're in that low cortisol state, and then because you're low, your body will use its last resources to dump out more. And so you'll have these like
Mm,
spurts of high cortisol, which is that 3 a.m. wake up, right? That's like
yeah.
your heart's racing, very much can mimic cardiovascular changes. This is why women a lot of times end up in the ER thinking they're having a heart attack when they're not. It's a panic attack, but it's driven by cortisol, right? So it is complex. If it sounds overwhelming, that's because it is that complex and it is very nuanced. But I would say for most caregivers, the pattern that I see is that low cortisol because you've been so depleted for such a long time. And so understanding that does actually help us to know where we need to start in helping somebody to regain some function of their adrenal glands and keeping their cortisol from wigging out all of the time, for lack of a better word. I was like
Hmm.
I had the worst cortisol dumps. Oh my God, it was awful. And so
Mm,
I'm like, I don't ever want to go to that place ever again. If that means I
yeah.
have to slow down a lot, then I will, because that's miserable. So
I'm having a hard time wrapping my brain around cortisol being low
yeah,
when you have chronic stress.
yeah.
What am I missing?
No,
Like, I
it
feel like, wouldn't it be dumping cortisol constantly, right? And
yes.
wouldn't that make it high?
You would think so, but it's actually if you think about and it is confusing, and I wish I had, like, a graph to visually show people because it does make more sense when you see it kind of in a pattern. We all have a baseline cortisol production that we should be in, right? Like this medium range, if you think about it like this. For those of you that are watching, I'm just kind of making a graph with my hands. Very rudimentary,
Yeah.
not exciting at all. We all should be within this range. But when your cortisol, when you have this bucket of cortisol that your body can tap into, because it requires resources, right? It requires nutrients
Yeah.
to make that hormone in the body, B vitamins, zinc, magnesium, glucose. All of that's needed to be able to produce cortisol. Well, when we're under stress, we're typically under eating or we're eating foods that aren't super nourishing because we're stressed, right? And so then we're not getting those nutrients to the adrenal glands to then be able to produce adequate amounts of cortisol. So, what I typically see is more like a flat line. When we actually do the testing, we'll just see a flat line where there's not a whole lot of cortisol production throughout the day at all, but there will be like a little bump at 3 o'clock in the morning where it's like, hey, we're just going to shoot this woman awake and make her lay in bed sweating and feeling miserable for an hour.
Right.
And so it is paradoxical and it is confusing, which is why I definitely recommend, especially for women over the age of 35, if you're experiencing those symptoms, don't assume that it's high cortisol. It very likely, and I would say most likely, would be more of a low cortisol picture, which requires a very different approach to resolving that.
Wow. Gotcha. And what does that affect? Like, I know that every chemical in the body doesn't just do one thing, it affects other things as well. So, are there like symptoms that parents could see in themselves that might be identifying that they have low or high cortisol, that system is sort of out of whack?
Yeah, absolutely. I would say it does range. There's, I would say, well over 50 different symptoms that somebody could
Wow.
experience. Some people experience it like shaking, like that hangry feeling when you get when your blood sugar is low. That's because cortisol is coming in to rescue the low blood sugar. So that like shaky, jittery feeling, it can feel like passing out, like that right before you pass out feeling where you're like a little bit woozy. That's some cortisol dysregulation. I do have some clients that experience like dry throat where their throat feels really parched and dry. They'll feel that like sensation to gulp a lot. Um, a lot of people do experience like abdominal, excuse me, how would you describe it? Like abdominal tightness where they just feel jittery,
Mm.
stressed, tight in their belly. That's a big one. And then when we have that can swing, right? If those symptoms continue to grow, that we'll start to see like physical appearance changes. So we might notice puffiness in our hands or our face, because we're retaining water to help dilute that cortisol. There's, a physiologic response to that. Weight gain around the belly. That's a very common one for women. I mean, it's hard to differentiate that from like what's perimenopause, what's
Yeah,
cortisol, but they go hand in hand, right?
they all
So there are some,
overlap.
yeah, they do. Lucky us, right? Um,
Hmm.
but there is some physical appearance changes. For a lot of women, it can range from, anxiety, heart palpitations, racing thoughts, that like racing thought, your brain just won't shut up, to just feeling very flat and fatigued. So there are, if you were to Google high cortisol symptoms, you would get a long list, which is
Hmm.
why testing can be helpful in helping us identify what pattern exactly are we looking at and what system are we looking at, because cortisol, it's I think about it like a rescue hormone. Its job is to provide us the quick energy that we need to rescue us from a stressor, right? But when we live in that state all the time, it actually can become quite toxic to the body. And that's where we start to see that chronic impact on all of the systems.
What else do we need to know about chronic stress and our physical health?
Kind of going back to what you were saying about self-care, I used to like it felt like a four-letter word to me.
Hmm.
Like if I hear one more person tell how much I need to take care of myself. Okay, well, are you going to come over and clean my house because my kid was having a meltdown for 5 hours? Like,
Yep.
it's like it just felt like this, like how do we even, you know?
Hmm.
I think the reality is that when you are a caregiver, regardless of the circumstances, when you're not getting to parent your child the way that you would if they were not struggling, whatever that struggle looks like, the burden for you is greater, which means that you have to change the way you think about your life and your stressors. That means that I have to create some sort of room in my life to manage that and create windows or margins or buffers. I don't have the option not to. Like that is the thing that I tell parents all the time. You have to flip how you think about this. This is no longer a when my child is better, I can X, Y, and Z, or I will eat better, or I will take care of myself. It means we have to do something about it now, before this becomes a bigger problem. And I remember one day I just kind of decided, and this might sound mean unless you have a child, you'll understand. Like a child that struggles like mine, you'll understand. She used to have the worst like sensory meltdowns around food, which was like you're supposed to rest and digest when you're eating, right? Like rest and digest. Okay, well, it's really hard to rest and digest when your kid is screaming in your face while you're trying to, eat a meal. And so I just decided one day I was going to let her throw the fit and I was going to eat my meal and I was going to reassure her, I'm right here. I'm not going anywhere, but I do need to eat my food. And, because what I was doing was I was skipping meals, because they were so stressful. And then, kind of not clinically binging, but basically like binging later because I was so hungry.
Yeah.
And that was creating, just a lot of issues in my body. And so the reason I'm sharing that with you is that sometimes we have to do extreme things because our situation is more extreme. It's not the average, right? And so that means that I have to create boundaries internally and externally to manage that. And so I think that's what I would say is the chronic stress is not going to go away until we learn how to manage this differently. And that looks like resourcing ourselves, advocating for help for us just as much as we're advocating for help for our child in all of the avenues that we're doing that with their doctors, their teachers, their friends, right? How many of us are actually doing that for ourselves? Not many. And we don't think about that as being, 2 or 3 pretty significant layers to burnout, right? Is that
Yeah.
we're outsourcing all of this, all of us to help our child, and we're forgetting that we also need that help too.
And I think mental health is also a big layer that will affect our physical health. I know for me,
Absolutely.
figuring out how to manage my stress, like I kept going to all these doctors and they kept saying, all your tests are fine. And, you just need to reduce your stress. That's what they would say,
Okay.
reduce your stress. And I'm like, how am I going to do that? Like, I didn't
Right.
understand that I could work on my mindset. I could work on my own
Yes.
anxiety. I could work on things that would affect the way that I felt about the
Yes.
stressors so that maybe they wouldn't stress me as much. Like the example that you gave with your daughter and saying, okay, this is our reality right now, that sensory issues, sensory struggles are going to make mealtime really difficult for her, but I still need to eat and I can't engage in that sort of intensity
Right.
with her. And that's stress management, right? Like that's what
Absolutely.
we need to, but that's also working on our own mental health. We have to get to a
Absolutely.
place where we can accept that it's okay to do that, that we, can actually really live it. Because I could say, well, I'm just going to let this thing happen because it's going to happen anyway. I'm going to take care of myself. I could still really be stressing internally. So there's,
Absolutely.
there's more to it that we really have to work
Absolutely.
on. But I think that mental health piece is a huge part of our physical health, and we tend to separate them
Absolutely.
too much. So I just wanted to add that layer to it because for me, it was really, I had to figure out my mindset to manage my stress. That was the only thing I was going to be able to do successfully to reduce the stress as they were telling me to do. And it took me years to figure that out.
Yeah.
They don't tell you that part, right? Like they
No.
just send you away and say, you're fine, reduce your stress. I'm like,
Yeah, okay. Well, what
you're
does
not
that look like
helping.
in this situation? And it is so different for, I would say from family to family, but even family member to family member, right?
Yeah. Yeah.
Like there was a period of time where my daughter did so much better just eating her food in her room. And if I had held so firmly to this belief that families eat together and that's how health happens, which is kind of how I was raised, right?
Yeah.
Everybody eats their family, which I think is wonderful, right? And now we do get to eat family meals together. But there was a period of time where that was costing me so much more in
Hmm.
this, stress area than it was to just let her eat in her room. And
Yeah.
like, come and join us when you're ready, we're here if you need us. You're being well fed. She's being well cared for. Nobody's being neglected. Everybody gets to eat a meal in peace. That is the goal, right?
Yeah. Yeah.
So, but it did mean shifting my mindset. And that is, I think that's where we struggle a lot and not even realizing maybe where our mental health is being impacted because it feels so in so many areas it's being impacted, right? It's
Hmm.
financial, it's emotional, it's in your marriage relationship, it's in your relationship with your other children and how they're being impacted by what's happening in
Yeah.
the family. And so that's what feels unescapable, but I think you nailed it with the I can work on myself. I can go to therapy. I can work on how I think about these things. I can work on how I process these things.
Hmm.
I can go for a 5-minute walk. I can yank weeds in the yard and throw them somewhere to get my anger out, Like any of those things are appropriate stress management. And it goes beyond, like you said, just manage your stress. Okay, well, if I had a magic wand and I could just get rid of my
Yeah.
stress,
Wouldn't
yeah,
that be
I would have
great?
done that. I would have figured that out already. I'm not, none of us are unintelligent here. So
Yeah.
yeah, you nailed it with that.
And there's just a separation. Like I'm going to MDs for my physical wellness,
Yes,
and they never suggested maybe you should speak to a therapist.
right.
Maybe there's, other components. Now, I probably would have
Exactly.
felt like I was being gaslighted if they had just said, talk to a therapist, because I would
Right.
have felt like they were saying it was all in my head. But like
Yes.
they weren't connecting that for me. And so it
Absolutely.
was really difficult to get there on my own. I know there's so much more that people can learn from you, Andrea. We
Oh.
have barely scratched the surface of this conversation. Where can they find you online so that they can connect and learn more?
Yes, well, I hope we get to chat more. This was a really fun conversation.
Yes.
Lots of places you can find me. I'm on Instagram. My handle is at Abundant Wellness with Andrea. I also have a private channel on there just for parents of special needs kids where we have, different conversations in there that are really enriching. I would say that's probably the easiest place to find me. You can certainly shoot me an email. It's Andrea at abundantwellnesswithandrea.com. I'm also on YouTube, but it's kind of just a longer conversation of what I share on Instagram. So however you want to find me, all three of those places are good.
And I'll link everything up in the show notes for folks too,
Thank you.
which is at parentingadhdandautism.com. Thank you for being here. Thank you
Oh,
for being real with
thanks for having me.
this
Yeah,
experience, because I think it's so important that we are speaking the truth for parents and not sugarcoating
absolutely.
it and not saying, if you just change your diet, it'll all be
I
great. Or if
know.
you just exercise more, everything will be fine, right? Like we're
Yep,
getting to the real nitty gritty of it. And
absolutely.
that acceptance that it is more of a struggle.
Yeah.
So I really appreciate that.
Well, thank you,
And
Penny. Thank you for having me.
of course, I will see everybody next time. Take good care.